Thank you very much, Sean. Okay, yes. Let me just try and minimize this. Oh, I don't want to know. Right, there we go. So yes, I'm here to talk about Piota Healthcare Apps and how our platform can help empower your patients. So let's get started. Just a little bit about me. Hello, my name is Chris. I've spent 20 years within the digital media industry doing various different roles, but a good chunk of that time was working directly for the NHS, producing a whole raft of digital solutions. Started off with sort of e-learning and learning management systems, the intranet, on induction systems, apps, and a whole raft of different other resources to boot. But really interested in and kind of at the heart of and the passion of what I do, and of Piota, is just making it easy for people. I think that's what digital is all about, isn't it? At the end of the day, if we can make it easy for people, if we can remove that kind of thinking process, people are more likely to interact and engage with it. If it becomes difficult, complicated, a bit of a burden, then people will perhaps shy away. So really focused on, as I say, making it easy for people. As an organisation, Piota, we've been in the healthcare sector for about 4 years now. We've got over 130 apps out there for health and social care clients, but we work with the likes of NHS England, Public Health Wales. We work with Integrated Care Board, ICSs, cancer alliances and trusts, and lots of different teams. I suppose everybody else within that spectrum. So we've got a platform that's been around for quite a long time now. It's robust. It's been tested to the nth degree, and our clients are utilising it now, and really wouldn't be anywhere without it. It's a platform that we've got. We're talking about healthcare apps, and our platform can be quickly customised to meet most of the needs of our clients. So the apps look a little bit of the same. Top half of the screen, there's some kind of corporate branding, logos, photos, whatever it might be. And then below there, we've got this sort of simple tile menu. Each of those tiles has a label and an icon, and it's meant to be fairly intuitive. You can download this app, pick it up, have a look at it, and start working with it, almost straight away. So these are just some screenshots of different apps that we've created. You can see the familiarity between the different apps. So different colors, different icons, different labels for different services. Historically, we've been talking about sort of patient experience apps and empowering patients to take control of their conditions and to learn more about and be more aware of the conditions and the service that they're in and the community and the support that's available. But more frequently, we're now seeing healthcare teams looking at the app for an extension of their clinical tools to be able to provide information quickly and easily to their colleagues. But what I propose to do during this presentation is just to show 2 or 3 different apps, a couple of sort of patient experience apps, and then a staff app just to kind of conclude. So as I say, a whole plethora of different areas. We're not clinical from background, so I've got a digital background. The team that I work with are also software developers, but it's the people that we work with, our clients, they have the clinical knowledge and expertise. We have the platform, and it's kind of, a marry-up of the two. We can help them with the platform so they can then start to, engage better with their virtual patients, but not just patients. I think, in this world that we live in, it's not just about patients, although, they're at the centre of everything that we do. It's about, families and friends and carers as well, people that support patient to ensure that they understand about the condition, they understand about support, they understand about all the local information, all the facilities and things that are available to people. So it's a little bit wider, I think, sometimes than just the patient. It's about that whole support network as well. Right, so empowering patients. Let's look at a couple of quick apps. Conscious of the time, so I'm not going to hang about. But yeah, it's all about providing that information to people in ways and means that's relevant to them. So using the phones just seems the natural way of doing things these days. Everyone's using apps for everything from traveling, shopping, banking. So why not provide your patients with all the information they need quickly on an app that can be found, relatively quickly. You can pull out your phone, then a couple of clicks, you've got the information you need. And as I say, it's not just necessarily about patients, it's families and carers as well. It's about empowering that whole support bubble to ensure they know everything and are aware of everything they kind of need to know. So this one's an app that we've created for Morecambe Bay. It's for their maternity team, and this is aimed at, as I say, new parents, not just new mums, but dads or significant others, families, grandparents, anybody who's sort of interested can download the app and then start to work through this sort of pathway, which is illustrated by the different icons and different labels on the app. So the information on here is all the information from Morecambe Bay. It's their information they want to share with their patients, so it's all been curated. And with all these apps, it's not necessarily about reinventing the wheel. In some instances, it's just about signposting to different resources. There's lots of great digital resources out there, but a lot of our clients just want to ensure that their patients are looking at the right stuff. That people aren't going onto Google and doing a quick search and coming back with lots and lots of information. The information has been curated, it's been audited by the different teams and then quickly distributed via the app. So this has a bunch of videos on there, again, aimed at new mums, and especially during the pandemic where a lot of this was done remotely. So you can go to the different birthing clinics to see, what would suit you best. Lots of guidance on there, lots of information for newborn babies. So, everything that new parents and or, grandparents or others would need to know about the service, about, what's likely to happen and all of the support thereafter. Within all of the apps, we have sort of a contact section, and these are phone numbers or email addresses or websites of the different people that you're going to need to interact with. And the idea again is I can pull out my phone within a couple of quick clicks. I can be speaking to someone in the assessment unit, or I can be speaking to a community midwife. I'm not trying to find websites or bits of paper or looking books. It's all there in one central place. It's a bit of a one-stop shop. My little sort of a virtual safety blanket, where I can just then go and find this information quickly and easily. And that's what it's all about, making it quick and easy for people, taking out the stress, taking out the burden of having to search around for it. It's all in one place. As we've touched on throughout the morning, it's all about push notifications and alerts, reminding people of different things that are happening, and that might be sessions within the community, it might be things that are happening within the unit itself. But it's just a great way of being able to do that sort of virtual tap on the shoulder. There's some new information here, there's something new happening, there's a new process policy that you need to be aware of. I think we're looking at our phones somewhere between 3 and 3.5 hours a day, little grants here, little grants there. So a little sort of indication from your favourite app about something new information is a great way of reaching out to people. Another example, similar, very different, is for Chesterfield Royal Hospital, and this is for the Macmillan Information Support Centre. So same principle, this is the Piota App platform, so it's been sort of branded with some imagery and some branding from Macmillan and Chesterfield Royal Hospital. Then below again it's a 3x3 grid with the menu system behind there. And it's the Macmillan nurses there that create this content. Again, historically, people would come into the centre and they would sort of get, be provided with lots and lots of paper-based leaflets about different aspects of the care and support that's available to them. But virtually they can be talking to people on the phone and sort of suggesting they download the app, because all the information they're going to need from here on in is going to be in one central place. It's going to be on the app. So really successful. They have, the team at Chesterfield have lots of banners and leaflets telling people about how to download the app and kind of how to use it. And it's firmly integrated now in the fabric of that team to try and get away from paper-based solutions and provide digital solutions, especially for something like of this nature, this particular condition, where it's not necessarily just about patient, as I say before, it's about ensuring families and friends and carers are available of all these different resources, of all these different support networks that are available, of all the different financial incentives that are available, how to go and claim for them. So it kind of opens this up to the whole support network in order to make that to make everyone's life a little bit easier. But it's just a simple solution. Once the content's been uploaded, and it's dead easy to do, it can be distributed there straight away. The app has the ability to translate into different languages. So we use Google Translate, and I think there's 100 odd different languages within the Google Translate library now. So if English is not your first language, it can quickly be changed into one of these different languages, and then can be easily then read by the different communities we've got. Contacts, same sort of principle again. So these are all the different units within the hospital, and there's call buttons where you can speak to somebody quite quickly. You can have links to Google Maps. So again, it comes back to that sort of theory of a one-stop shop. I've got a question, I've got an idea, I want to go somewhere, I need to be somewhere. I can go to the app, I can click a button, and the information's there. It's all very quick, all very easy. Then lastly, we're seeing more and more now, I should say, I'll take a step back. Historically, we've always been involved with sort of patient experience or sort of empowering patients with the apps that we've got. But more frequently, we are being asked to create apps for clinical purposes for staff. So whether they be sort of well-being or staff engagement or protocols or procedures apps, it's just about being able to provide information in a quick and easy format that the clinical staff can get hold of. So this is a typical app, or this is one of our typical apps, and this is being created by a consultant at Dudley Group of Hospitals within their emergency department team. So, really looking at how can I make my team more effective? How can we save time? How can we see, potentially more patients, and to get more people kind of through the door in a safe and effective manner. So I think when he was looking at the team and how how they worked. From time to time, there was a little bit of a queue waiting at computers. So whilst there are computers within the team, and plenty of them, there's plenty of people that need to be accessing them for different records to get onto the PAS system to ensure they've got the X-rays or blood results. So for some of their staff, which are sort of fairly transient, lots of locums and medical students and junior doctors coming through that weren't quite sure about a particular policy or procedure. They would need to make their excuses and leave the cubicle and sort of go and ask someone to log out to computer so they can log in and go and find a bit of information. And all that in itself takes not matters amount of time, but if you think about every transaction or most transactions within the team itself, it kind of soon mounts up. So what the consultant wants to do is really sort of extend the reach of the internet to make it more accessible to everybody, but through a platform that everybody on that has on their person, i.e. a mobile phone. So what the consultant did was took all the guidelines, policies and procedures initially. That was his initial thought. And as a member of the team, I would need to sort of register onto the device. So it's not like the general public can download it and start viewing all the policies and procedures. Well, there's nothing in there that they wouldn't want them to see, but they don't want to see it essentially. So they would log in, get registration, and then they can go onto the different sections and they can find all of the standard operating procedures quickly. Within 2 or 3 clicks, they can be opening up the different policies, the different paediatric guidelines, and they're just all categorized into different areas. And I say within a couple of clicks, you've got the information open to you. It's all accessible. You can do this at bedside. You can be having a conversation with the patient on your phone, just explain, this is a tool and we're looking to be, more efficient and, see more people and provide a better service. But you can potentially do this at bedside, look, a couple of clicks and you can find the information that you need, and you can be, well on your way to providing the right information. All sorts of information on here. So that was the primary focus, was to just make information more accessible. But then, took a step back and what else can we use this for? So, looking at his colleagues and looking at their needs, little things like the rota, which historically you'd need to be logged into a computer at work to be able to access, to make that sort of more accessible from home, or wherever you want to access it from. Lots of different forms then, again, that kind of need filling in, from annual leave request forms to handover sheets to training, managed training notification forms, all again somewhere on the intranet that you need to find some time and be able to get onto the intranet and then sort of find these forms. But again, it's just really quick and easy just to put them onto the app. Our app system, the Piota App system, has a sort of form generator within it, and if you're sort of familiar with Smart Survey or SurveyMonkey, it's very similar. It's dead easy to use, but you can then put those forms together, share those with your communities, with your audiences, and be able to gather that feedback very quickly, very easily. Again, a directory, so every consultant, every personal assistant, every team, all listed. So, rather than trying to find that bit of paper stapled next to one of the computers with someone's phone number on it, it was just all there. And I can, again, click the button, press that, press the call button. I'll be speaking to that person, from their pickup, of course, relatively quickly, really easily. And again, it's just making information more accessible, taking that think out of the equation, and just allowing people to kind of get on and just do it. So yeah, mandatory training on there, a whole host of different resources, just really making it easy for his colleagues to go about their day-to-day business. Obviously push notifications and alerts, so again, to be able to give people the heads up of different things that are happening, lamp testing, Wi-Fi downtime, blood gas results, just a selection of some of the areas that this consultant is sharing with his colleagues. So just to finish off, the Piota App solution, as I say, it's been around for 4 odd years now. We've had lots of different updates and changes in that time. So, it's stable, it's robust, it's tried and tested. But it composes of 2 different aspects. We've got a kind of cloud-based editor where staff, and it doesn't matter your level of technical or IT literacy, it's dead easy. And if you use Word or PowerPoint on a regular basis, you're familiar with all the tools and all the functionality. It's super simple stuff. And obviously then the phone, which is, you should then distribute or share with your colleagues. But you go onto the different sections, you can fill in the, you can create a simple form, put some text, images, web links to different portals or different resources, and then distribute it within minutes or seconds. It's so easy. You've got a little analytics engine, so you can then see how many people have downloaded the app, what sections they've been sort of navigating to, what pages they're reading. So you can start to then, build up an overview of how people are using the app and what information they're using. And that's an example page of the editor. As I say, a lot of the tools there, a lot of the functions you're familiar with. There's nothing complicated. It's really, really easy stuff. What does a typical app process look like in my world? Well, there's always the inquiry. So, reach out after the event if you're interested. But we'll get inquiries where people come and talk to us about something that they're wanting to do. We will probably have at least one example of another organisation, another trust who have done something similar, so we can quickly share that with you, just to give you a feel for what other people are up to and how other people are overcoming the same sorts of challenges. We can have a bit of a discussion, we can talk about costs, and it's not an expensive solution. It ranges from sort of £2,500 to £7,500 a year. £2,500 to £7,500 a year, depending on how many users to license this. So it's not a very high costed solution. It's quite a low cost, low risk solution in that respect. So it's it's quick and easy to get through the system. But we can produce a free trial. We'll work with you to get some of your content, to get some of your branding. So this thing looks and feels like it's part of your your digital offering, which then you can use to be able to show to your colleagues or to work with different pilot groups to show them this is what we're wanting to do. This is the sort of information we want to share. What do you think? And then kind of once you've got your agreement, we can we can kick off the project, and literally these apps can be up and running. I think I know it's not a race, but I think the first one, the best one we did was within a day. A chief nurse at one of the CCGs at the time came to us at the start of the pandemic and wanted to provide an app for care home staff. And we started in the morning, and by the late afternoon, she was emailing the care home managers, encouraging all staff to download this app, because this was the way that we were going to keep you updated with all of the goings on during the pandemic. So it doesn't have to be long, it doesn't have to be drawn out. Typically, as I say, we can get these apps up and running within a few days. We'll work with you to provide you with trial apps to be able to take that to your colleagues or to patients or to your leadership groups for their feedback, and really move relatively quickly with these things. So it doesn't have to be overly complicated, it doesn't have to be long and drawn out. We've got a solution here that's tried and tested, that's being used by over 130 health and social care clients already, that can be running in no time. And I think that for today is me. Thank you.
Thank you very much, Chris. Can you hear me okay?
I can hear you okay, Sean, absolutely.
Perfect. Well, we've got a ton of questions here. However, I'm just going to prompt the team to get the poll on the screen right now, and then we'll get a few questions asked Chris. I won't be able to get them all out I'll send them over to you afterwards anyway, and you can build that conversation up afterwards. So Claire started us off here with, is the Piota app more of an information providing app rather than data gathering app?
It can be a bit of both. It can be a bit of both. So yes, historically, it's about providing information to patients, families, carers, staff with information. But you've also then got that ability via the feedback forms or the surveys to be able to gather information. So people will use it for friends and families, as I described in one of the operational aspects. It's different sort of operational forms. And then some patients are using, some clients are using it directly to kind of get patient information prior to them coming into clinic. So, to reduce that time taken to get to the root of problems and issues. So it can be used in different ways.
Perfect. Sarah here, looks really interesting. Our patients are mainly over 65 who are moderately to severely frail. Have you had any success with the apps via this cohort?
I guess every 65-year-old is slightly different to the next 65-year-old, but I kind of get it. I guess they're using their phones for other things. I can only take experience from my mother, who's slightly older than that cohort, but she's using her app, her phone now for lots of different things. I think pre-COVID, perhaps we would have been we're not quite sure about that cohort, but I think now. For most part, people at least, I think the pandemic has forced people to look at their phones a little bit, in more detail and to be more experienced and more familiar with them. So I don't have direct experience, but that would be my my initial sort of knee-jerk reaction or initial thoughts to that particular question.
Yeah, the apps are super user friendly, aren't they? So I think you made it.
They are easy. There's nothing in there too complicated for people. Thanks, Sean.
Perfect. So Claire here, is your solution able to cover estates and facility services such as food, cleaning, and even portering?
We have examples where teams have used it, especially for that particular audience. I think that the last speaker talked about the digitally excluded. So that audience itself has no access to computers. They're not like they've got a desktop computer or there's a computer within the ward that they can access. So we've got examples of facilities teams using it to really reach out to those audiences. So if you're interested, I can quickly do your demonstration and show you how people are using it in that context.
Well, that's a bit of a call to action there. I think it was can't remember who asked that question there actually. So anyway, just get in touch and Chris will show you that. Just wanted to end here on more of a comment from Debbie. So Debbie said, thank you, Chris, for mentioning unpaid carers. This resource will be very helpful. So thank you.
Thank you very much, guys. Have a good afternoon. Enjoyed it so far.
Cheers, Chris. Thanks again.
Cheers, mate. Bye-bye.
See you soon. Bye-bye.